Okay. Good morning, good afternoon, good evening, everyone. Good morning, good afternoon, good evening, everyone, depending on where you're joining us from. We are able to go live on our Instagram and Facebook, and we are happy to have everyone joining us for this lecture today. Feel free to listen and be ready to ask questions. We will be happy to have your questions answered. Okay, so without further ado, I want you to remember to send an invitation to remind your people, your friends, your family, your colleagues, and share this live with them. Remember that this is not just going to be we are not just going to be talking about managing low back pain. We're also going to be talking about prevention and care to make sure that care for the back, to make sure that we are not predisposing ourselves to low back pain. So briefly, before we start, I have to mention that this lecture is brought to you by Fitsplurge, and it is to mark the World Physiotherapy Day that happened yesterday. World Physiotherapy Day happens around the world and is celebrated globally on the 8th of September annually. And for this year, it fell on a Sunday, and we thought we are going to celebrate it, mark it today by bringing you this lecture. The theme for this year's observance is on low back pain, and that is why this lecture today is timely, because we are hoping to talk to you about the global epidemic that is low back pain. Okay, so first we have to talk about the definition. What is low back pain? Low back pain refers to pain that is felt at the low back region. As simple as it sounds. But I know that it's a bit complicated when we're trying to define the low back. Now, a lot of people don't understand what we call the low back. Which part of the body is being described as the low back? So, the low back is the region of the body that is the lower back. Just try to divide your back from the upper back, and then you have the lower back. And then, because of the significance of this problem, we are going to go ahead and describe the low back to mean from the lumbar region, and we're going to include the sacral region. That's the lumbosacral region. And so that means that when we're talking about this low back pain, we're talking about pain that is felt from the region of the mid back. Just after the mid back, you have the low back, and then from that low back down to where you have the buttocks. Now, because this part is the spine, it's made up of vertebrae, the lumbar vertebrae, and then you go down where we have the sacral vertebrae and so on. We have to understand that these joints are very fragile. So you have to be very, very careful what you do. The kind of movements that you do, the things that you do and do not do can contribute to low back pain. Now, what is even more interesting with low back pain is that even though we have described the region of the low back, sometimes the pain is not localized there. And the reason is because the spine, the vertebral column, as we all know, is housing neural structures, right? So because there are nerves there, now these nerves run down to the lower limbs. And because they run down to the lower limbs, anything that affects this structure at the low back at that point can cause pain to radiate down to the lower limbs. Now, lower limbs sounds a little bit technical. I'm going to try to break down what we mean by lower limbs. Lower limbs basically would be the... Why is it ending? I don't know why it ended, so I have to try to on Instagram. Okay, so the lower limbs would go down all the way to your feet. So we're starting from right from, you know, like where you have your buttocks down to your feet. Now, in layman terms, we call that legs, right? However, technically, what we describe as legs anatomically is not exactly legs, but for the purpose of this lecture, I will just call it legs to keep it really simple. Now, when the pain moves from the low back region, it can go down to the legs. And so you start to see someone who is having pain at the back, but then they may not be having symptoms at the back, but they're having the symptoms on the legs. Yes, they will tell you that they're having pain, radiating pain. They will tell you that they're having tingling, numbness, sensation, pins and needles. But these symptoms are not felt at the low back region. These symptoms are felt at the legs. The reason is because the nervous supply of the legs, when I say legs, please, after this, can you go and check what is referred to as the lower limbs, okay? So the nervous supply of the legs is coming from this lower back. So what you now feel at the leg is primarily not coming from the leg itself, but from the lower back, from the low back region. So it's very, very complicated because statistics show that low back pain is the #1 cause of disability. Yes, it means that the crippling pain can cause disability, can cause impairment that can put someone on a wheelchair, low back pain. Now, there are so many ways where you feel crippling pain on your waist and you cannot stand erect, you cannot move because of the crippling pain that is coming from your waist, your low back region. But then there's also the other symptoms where it starts to weaken the muscles of the legs, it starts to send numbness to the legs, and then you have this radiating pain that cripples. And that is why low back pain has been described as the #1 leading cause of disability. Let's look at the statistics a bit more. Low back pain has also been described as a very common cause of hospital admissions, yes, loss of days due to sickness. People working understand what this means. It means that you're working and for some reasons you have to be bed bound. You have to stay away from work because you had a low back pain. It has also been noted that almost everyone at some point in their life will have low back pain. Interesting, right? Interesting that when you do a random survey, you would find out that people that you would talk to would have already had low back pain in the past, or may have low back pain at some point in their life. Every single human, every single person. That's the state of the epidemic that we have upon us. Why is it so? It is about the things that we do and the things that we do not do. So the extent of the burden is so impactful that it is a global health problem right now. Most times in the past, previous researchers used to attribute low back pain to just a consequence of aging. But we have come to realize that people can age healthily. Well, there is the question of overuse, which logically means that over time, right, after a few years, you would have used your joints and then you start to have overuse. But in a situation where you're doing the wrong activity, you're doing the wrong things, it means that you're going to reduce those years. So it's not just a consequence of aging. It's not just a consequence of overuse due to aging. It's also a consequence of the things that you do. So low back pain is mainly attributed to lifestyle, a person's lifestyle. So at the end of the day, we can distinguish the causes, and say, oh, aging, everybody is going to age. But like I said, you can age healthily and delay the overuse. So it means that, repetitive strain can cause you to have low back pain even earlier in life. Yes, that it doesn't have to happen when you age. Now, we look at lifestyle, and the number one lifestyle causes would be the sedentary lifestyle. The sedentary lifestyle involves a lifestyle where you're not exercising, you're inactive, you're staying in static postures for long durations. So it means that people that sit a lot and people that have to not do exercises are predisposed to this condition, because our bodies were created to move. The joints of the body work better when we are moving. Our body was created to move. Our body we function better when we are moving. So in a situation where we are not moving, we are staying in static postures, it's going to pose a problem. So the sedentary lifestyle, which is inactivity basically, will cause you to not have adequate movement within the joints of the body. Now, the joints of the body are supposed to move. You're supposed to have those movements, and those movements are very important. They function to prevent adhesions within the joints. Now, when you move your body, the body produces synovial fluid to lubricate the joints. When you move your body more, the more you move your body, the more your body is lubricating these joints. The more your body is producing this fluid to lubricate the joints. When you do not move your body, it means that you're producing this juice, this synovial fluid, less and less. So you want to move, but then you also want to do it within the movement directions that are safe. So inactivity is a problem. Overuse, remember we talked about overuse, is a problem. Now we're going to, before we end this, we're going to bring it down to what is necessary. So it means that you have to cut out prolonged static postures as much as possible. I know some people don't even know that their low back, that is the lumbar region, can do rotations. You can move like that, and you can do side bendings, and you can do forward bendings, and you can do back bendings. Most of the times, we can stay through without moving our bodies within this movement directions, and that can cause stiffness within those joints because, like I said, our body was created to move. Let's look at the second lifestyle factor. Now, let's talk about loading the joint. When we're talking about loading the joint, we have to understand that prolonged static postures where you're sitting down for long in a certain position, or even when you're standing for long. That's why you see this condition amongst people that will say, oh, but I'm resting, but I'm always resting. Yes, always resting is actually a problem. So you can be loading your body with your own body weight. You can be loading the low back region with your own body weight. Now, what this means is that when you sit down, let's say, for instance, in a static posture, you end up putting yourself in a position where your lumbar region has more weight being sent to it. Now, when you're sitting or you're standing, you're loading. It's the lumbar region that is going to be taking that load. Now, imagine that you're doing it repetitively. It means that you're exposing the low back to more and more loading. Now, that's duration. But there's a tricky thing somewhere there. How about people that are overweight and obese? Yes, it means that if someone who has a normal weight is loading their back, right, their low back, in a certain duration, someone that has 2 times that weight is going to be loading the back even more. Double of what someone with a normal weight. It's just simple logic, right? So, overweight and obesity is a very common factor. It means that when you're sitting, when you're standing, the excessive weight is just impacting and loading the back. And now we have talked about the weight, we've talked about the duration of prolonged static postures. Now let's talk about bad postures. Yes, you see situations where people are loading the back in wrong postures. For instance, you see people loading the back in the slouch position. I don't know if you've heard of that position before, where you're sinking in. The back is supposed to not be straight. The back has this curvature. I don't know if you've seen a skeleton before, the human skeleton, and then you go to the spine, you will see that the spine has those curves, right? We have the cervical lordosis, the thoracic kyphosis, and then we have the lumbar lordotic curve, and then we go back to the sacral region with another kyphotic curve. Now, that is whenever you are supposed to stay, you're supposed to always remember those curves. That is why if you go to an ideal office, an ideal chair is sound, is safe, is manufactured to support those curves. The chairs are manufactured in a way that they support those curves so that when you're sitting, you're maintaining that normal curvature, spinal curvature. For some reasons, you find yourself sitting in bad postures where you're either slouching or doing anything that you alter that normal spinal curvature. You're exposing your back. That is a predisposing factor. So we have different types of loading, and we can go on and on. And then, of course, I'm not going to end this without talking about another type of loading which also has to do with lifestyle, which also has to do with, of course, is just continuing to talk about the lifestyle. We're going to talk a lot more about the lifestyle. Sleeping surfaces, right? Now, I don't know if you've noticed, right, where you sleep on a surface that is maybe too soft, and then after getting up, you find that there's a hollow, right? That sleeping surface is not the best for your spine. It means that your spine is going to find itself in wrong postures when you're sleeping. You're supposed to find a bed that is a mattress that is firm enough to support your spinal curvatures without drooping, without allowing you to drooping. So if you lie on a bed and it's drooping, you get up and you find that your entire body is drooping into the bed, over time, you're going to find yourself beginning to have pains, body pains, and more often than not, people usually complain of back pain. Back pain, not just low back pain in this scenario, but you will see people with pains, mid-back pain, low back pain, upper back, and so on. So you have to also understand that when you're sleeping on a surface, the surface has to adapt to your body. It's not supposed to be hard, it's not supposed to be soft, it's supposed to be firm, to be able to take your body weight without you having that sinking, that drooping of the mattress. And the pillow, on the other hand, is supposed to be soft to allow you to have a more aligned position. And finally, talking about loading still in bad postures, loading and loading, we're going to talk about people that work jobs that strain the back. So we find people that work jobs where there is repetitive strain on the back. I've talked about teachers that have to stand for long in static postures. I've talked about bankers. I've talked about people that work jobs that allow them to sit for prolonged periods, in static postures. It means that what you need to do is to disrupt those static postures. Get up, sit back, get up, sit back, and get up as much as possible. If your job requires that you have to concentrate and focus and stay in those postures, get up. We have standing desks now, right? You get up and stay on a standing desk, and after you switch position and go to sitting and go to stand, so you're not in a static posture for long durations. And now we also have people that work heavy duty jobs where they have to carry very heavy loads. Now, for those people, my recommendation is to speak to a physiotherapist as soon as possible. What you're going to do is to find those positions, safe positions that allow you to do your work without impacting on the structures of your back. So, for example, when we have people like laborers that have to lift up heavy load, we always recommend that instead of bending over to take the load, where all the load is impacting on your back, you can go into a squat and then lift it more safely. I'm not going to be demonstrating today because there's a lot for us to talk about today, but I'm going to recommend that you seek the services of a physiotherapist, especially if your work predisposes you to this sort of lifestyle situations that can predispose you to low back pain. It's a serious conversation because a lot of people don't understand that prevention is always the best bet. I know that most people do understand, but most of the time we rather always try to postpone and think about, oh, maybe it will not happen to me, maybe it won't happen to you. But researching, we are going to rely on what the research says. So research says that if you don't do what you're supposed to do, there's a likelihood that it could happen, a very serious likelihood. Now let's talk about the management. Now there's pain, and one thing that people do when they feel pain is to take painkillers. Now for low back pain is very interesting, because low back pain most of the time is signaling you to something that is wrong. Something is wrong, and you must fix that. If you want to address low back pain, ideally what you should do is to try to understand what the problem is. Go straight to the problem. Focus on the issue. Now, pain is discomforting. Now, let me break it down for you. What it means is that when you take painkillers, painkillers do not solve the problem. Painkillers will more or less focus on numbing the receptors of pain in the body. So there are pain receptors, and what this means is that if the problem is really, really very superficial, maybe trauma, maybe you slept in a bad position where you just need to rest. Let me bring this home. Okay, so you have a problem, right? But you've not addressed the cause of that problem. You just take painkillers to take your mind to numb the symptoms, to numb the effect, to make you feel comfortable. Yes, to take away the discomfort of the pain. That's what the painkiller does. It doesn't address the cause of the problem. Now, this is where it is beneficial. If, for instance, your body just needed to take your mind away from the problem and allow time for the thing to wear off, the pain to wear off, you are safe. If you just, let's say in the case of a trauma, you've experienced this where let's say you hit your hand on a surface and it's painful, and a few minutes is still painful, you give it some time, 1 hour, it's still painful, the body is basically just going to repair itself at some point, and you don't feel the pain again. You're safe. Now, if the pain is so discomforting and you take painkiller to numb the pain and allow you time for the body to heal itself, then painkiller is great in that point, because it takes away the discomfort and allows room for the pain to go away on its own. But if in this situation you take painkillers and you're able to numb the receptors of the pain, that it does not allow you to address the cause of the problem, you're doing yourself more harm, right? And let's go back to hitting our hand again. You hit your hand on the wall, you feel pain. What do? You remove your hand immediately. Pain signals you that something is wrong. That when you hit your hand on the wall, you're going to cause pain. That pain is eventually going to cause damage. You keep hitting your hand, it's going to cause damage. It's going to destroy things, right? Now imagine that you take painkiller and it numbs you the feeling of that pain, and you just keep hitting your hand. So you've not stopped the cause. You've just stopped the feeling of the pain. So you just keep hitting your hand. That's exactly what we do sometimes. The cause of the pain is there in the back. It's trying to signal you that this thing you're doing every day is causing damage within the structures, but you just take painkillers, it numbs the feeling, and you continue doing the same thing. Let's bring it home. Imagine that you walk into your room and there's a foul smell. This foul smell is maybe transient, right? You put some diffusers, air freshener here and there, humidifier, and then the smell is gone. What the air freshener does at that point is neutralizes the smell, the odor, and allows you to be able to stay there. And it's good because you allow time. With time, the odor is going to neutralize, it's going to go away. Now imagine that You walk into that room, and what caused that smell is not something that is transient. It's actually something that is there. So imagine that, let's say there was a dirty plate with food in the room, and you come in there and you spray some air freshener and the room smells good. You've been able to numb the effect of the smell, right? And so you do that, and then it wears off. It's not taking away the dirty plate. And so the smell comes back. You go back with your air spray, your air freshener, right? Your fragrance. The room is back to smelling good, and you keep doing that. And what you don't understand is that every single day, the plate with the food keeps decaying, keeps deteriorating. You know, it's not like the first day. It's not like the second day. Every single day. That's why in medical science, we always say that early detection is key. The best thing that you can do to yourself is to actually understand that if pain is signaling you to a problem, addressing the cause of that pain is your best bet. And the earlier you do it, the better. What it means is that with early detection, low back pain can actually signal you to a problem that you can address, and it will not cause irreversible damages. What that also means is that the low back pain that you can feel can cause severe damages. Remember that I said when we started this webinar that low back pain is the number one cause of disability. So, we've been rambling and rambling and rambling. Let's bring it home. What does it mean, reversible and irreversible? Okay. It means that you can have very mild forms of low back pain. For example, I talked about sleeping in a bad posture. You can sleep in a bad posture and wake up, and then you realize that you have tension, strain of the muscles, which means that with some stretches, like there's tightness in the muscles, with some stretches, you're able to release that tightness, and then the pain goes away. With massage, you're able to relieve the tension, and the pain goes away, But imagine that pain is so superficial like that, but it puts you in a position where you start to compensate. Because of the pain, you start to tilt your body to one side, or, to compensate, to avoid this pain. And so it moves from just being like a simple muscular pain where you start to compress structures, the more deeper structures, the bony structures. And so you realize that the pain is becoming more and more severe. The pain is becoming more and more intense. But you're avoiding it. You're managing to avoid it. And so, at the end of the day, you're able to trigger more severe forms of low back pain. Now, I have to also mention that low back pain can be managed conservatively. The mild, very, early onset, even early onset arthritis of the spine can be managed conservatively. Now, when you allow it to get to the position where you start to have irreversible damage, it might require surgery. Yes. So, early detection is key. Now, when you think about low back pain, think about the fact that the more deeper structures, that is the bones within the body, within the spine, the vertebral bones, the ligaments inside, within the spinal column, can cause the muscles to become tight. Maybe because there is degeneration, there's reduced disc spaces, there is collapse of the vertebrae within the bodies, within the spine. There is a shift listhesis, prolapse, there could be something structural within that is causing the pain and making the muscles to become tight. You see, it can come from deep, and the muscles are becoming tight and there's tension in the muscles where the problem is coming from deep. But also understand that you can also have this sort of superficial pain where there's just tightness in the muscles, there's just, changes in the superficial layer of the body, and then you start to compensate till it starts to affect the deeper structures, the bony structures. So it can go this way or the other way. And that is why when you think about low back pain, you always understand that it can come from any cause for different people. For different people, that is why it's always important to understand what the cause of your low back pain is to be able to address it effectively. Okay, before I wrap this up with the management, I have to also mention that sometimes, like I started mentioning, sometimes you can have degenerative changes like aging, and then you start to see those stiffness, those adhesions causing stiffness within the spine. What that means is that those degenerative changes can lead to, for example, you start to have narrow disc space where the vertebrae, the upper one and the lower one, they are rubbing on each other because the space in between is narrowed. There's degeneration. There's something that is supposed to be in between the two vertebrae. But for some reasons, right, it's becoming narrowed. Maybe due to degenerative changes, the disc spaces are drying up, okay, with aging, and arthritis setting in, and so many complications. And so you start to have the narrow disc spaces where the vertebrae are rubbing on each other, and that is causing pain. Now, there are going to be stages for this. Like I said at the beginning, inactivity can cause those structures in there to start to stiffen up. Yes, it can. So what you want to do is, as soon as you meet a physiotherapist can diagnose and say that, oh, we're still at the early stages. What you need is a lot more movement to trigger the synovial fluid to lubricate those joints a lot more frequently. You see, and you have solved a problem that would have degenerated to the very irreversible stages requiring surgery. So that's why early detection is always key. Now, when we celebrate World Physiotherapy Day, the whole essence is to throw more light on the role of physiotherapists, to showcase the work that physiotherapists get to do in healthcare, their role, their contributions in healthcare. Low back pain is one area where physiotherapists function very, very significantly. That is why when I'm talking about, I'm saying, oh, go and meet your physiotherapist, because more often than not, like I started to explain, when you go and explain your symptoms to a doctor, the doctor is supposed to refer you to a specialist. And as healthcare professionals, what makes us very trained and skilled professionals is knowing when to send a patient to which specialist. Bear that in mind. So when you have low back pain and it is, let's say, in the acute phase, just a few days, few hours, few days, you're feeling pain and your doctor says rest, take some painkillers and go about your duty, right? And then you realize that the pain is still persisting. It's going into is going from hours to days, to weeks, to months. And we're talking about chronic pain. You have to understand that you are not being smart about managing your low back pain at that point. Because the moment it goes to chronic stages of low back pain, where it goes from days, weeks, months, you shouldn't be taking painkillers at that point. I've taken time to explain the role of painkillers and how it works and how it doesn't address the cause of the problem. Your focus should be on addressing the problem. Addressing the problem. Get a physiotherapist to evaluate, to review you immediately. Sometimes a physiotherapist, not even sometimes, most times, a physiotherapist doesn't need any radiological investigation. What I mean is X-rays, MRI, CT, computed tomography, to be able to ascertain what the problem may be. A trained, skilled orthopedics physiotherapist, spine physiotherapists, musculoskeletal physiotherapists, they come with these tags, to show you that they are skilled in that area, will not need a radiological investigation to know what your problem might be. They'll put you in a consultation room, they will do some physical examination, and they might be able to just ascertain the cause of your problem just based off of that subjective, you telling them, oh, I was doing this, I was doing that, and then I started to feel pain, and then doing some movements and some special tests and some really, really simple manipulations on your body, simple technical manipulations on your body. They will be able to establish the cause of your pain. And like I said, early detection. One thing about medical science, one thing about medical practice is that every second matters. Every second can save your life. Every second matters. Just knowing the right thing to do at the right time can save you years and years of surgery. Now let me tell you what is even more interesting. Most times people would take painkillers and they would not want to see a physiotherapist. They will end up leaving the problem to deteriorate into very irreversible situations where they end up getting surgery. Now, when you do get surgery, you're still going to have to go back to a physiotherapist for your recovery. So, it's very, very interesting. One thing I want you to take home today is that early detection is key. Low back pain can lead to disability, and painkillers are not the solution. Now, talking on that point, and I'm going to be rounding up with this particular point. When you focus on taking painkillers without addressing the problem, for chronic conditions, I always recommend, if you find ways to relieve your pain without having to use painkillers, you'll be doing yourself a whole lot of good. So when somebody says, oh, I was feeling pain and I had a massage, I was feeling pain, I was having a headache, and I took some tea, some organic tea. I don't want to drop any names because I don't want to feel like I'm making any recommendations. No. So I took some tea, and because of that, I didn't have the headache again. I had a bath. You have saved yourself a lot. Because with every painkiller that you take, you expose yourself to a lot that you can wrap your head around. You expose yourself to a chance of having the side effects of those drugs. You expose yourself, not just the side effects, you expose yourself to the risk of messing up your pain threshold. It means that you get to the point where you start to abuse the drug, that you feel small pain, and what another person will just take a small painkiller for, you need higher doses of painkiller to be able to address that pain, because your body has adapted to your use of painkiller for very minor issues. You see people go to surgery and they are loading them with very strong opioids, but they cannot stop feeling pain because they have messed up. Their pain threshold is so low that they cannot endure any form of pain. Also, using a lot of these analgesics, you will be exposing yourself to ulcers, liver damage, kidney damage, because your body, these are chemical substances that your body has to process into your body, right? Absorb and then send to where you're feeling pain to numb the pain. So there's a chemical process. It's not just, painkiller, it's food. No, there's a whole process. So the more you find ways to not load your body with these chemical substances, the better. As much as possible, if you have chronic conditions that allow you to find other ways to manage your pain, please do so. Do not subject yourself to the use of painkillers, to the use of analgesic routinely, frequently, because they do more harm than good. So when next you have low back pain, when next you're feeling pain, when next you're feeling not just low back pain, any type of pain, the question you should be asking is, what caused this pain? What might possibly be the cause of this pain? And when you're able to answer that question, you will know the right things that you should be doing. And of course, you might not be able to answer that question on your own, and that is why it's always best to seek the services of an expert. On that note, I'm going to be rounding this up and talking about the fact that there are so many supportive devices that can help you to alleviate pain. I talked about sleeping in good positions, especially pregnant women. You end up sleeping in positions with your big tummy. You wake up and you realize that you're feeling pain. These are things that supportive devices could have helped you prevent. You're sitting in a chair. The chair is not ideally recommended for your back. It's not supportive. There's so many supportive devices that have been created, that have been produced to help manage these situations, to help make life better. But you're not even aware of them. And that brings me conclusively to mention that at Fitsplurge, you can get access to professionals. You can get access especially to a physiotherapist, where you can discuss not just your pain, but also ways to prevent low back pain. So, licensed and trained physiotherapists will know the recommendations to make for you that can help alleviate your pain while doing work. We understand that you have to do work. We understand that you have to work to be able to make money, to be able to live, to be able to, but there are safer ways of doing everything that you need to do. All you need to do is to get access to the right information. And that is why when you seek an expert, they are trained in that field. They are trained, they're skilled to know the things that you do not know. And that way they are able to support you with their years of knowledge and experience. And that is why you always seek the help of an expert. You can't know everything. It's not possible for you to know everything. And that is why you have professionals in different areas. So feel free to click the link in our bio. Feel free to check our bio, check our details, and reach out to get a quick consultation with a physiotherapist if you do need to ask questions about low back pain or preventing low back pain, or if you find yourself working those jobs that can predispose you to low back pain. You can find safer ways of carrying out daily tasks, daily duties without putting your back into bad postures. And finally, also remember that Fitsplurge also stocks supportive devices that can help you with preventing and managing low back pain. And also, exercise is key. You can sign up to one of our exercise plans to help you stay active and make sure that you do not have to deal with weight disorders that can predispose you to overweight, obesity that can load your back, and also more importantly, that you don't have to worry about being inactive and dealing with the complications of the sedentary lifestyle. So, like I said, you can find the details to contact Fitsplurge in our bio, and you can also call our hotline from wherever you are. You can take this number, +234 8024 598959. I repeat, +234, which is the country code for Nigeria, and then it's 8024 598959. And that means that if you're calling from Nigeria, you can call 08024 598959. You can also find us on all social media platforms, linking in, just like you were able to get on this live from one of our social media platforms. It means that you can find us on several social media platforms if you check for our hashtag Fitsplurge, FITSPLURGE. You should be able to get a link where you can contact us, where you can speak to one of our staff directly, and they should be able to point you to the right health professional that should be able to address your specific concerns. Once again, thank you so much for doing this with us. I hope that this was beneficial. If you have questions, we are able to take questions. If you can type your questions, we should be able to answer a few questions right here, right now. If you can't, if you're watching later or you can't send your questions immediately, you also can send in your questions to us. All you need to do, like I said, is find us on one of our social media platforms or using our contact details and reach out to us with your specific questions. Don't forget that we might just be somewhere close to you. All you need to do is ask us where we are located close to you. We might have a center that is really, really close to you, and all you need to do is to know where we are located close to you. Thank you so much once again for joining us, and remember that this webinar, the topic was low back pain, addressing this global epidemic. I hope that this was insightful. I hope that this was rewarding for you. I hope that the time that you spent listening to this lecture was worthwhile, and that you're not just going to go away, but you're going to go away a more aware and transformed person. And that way you're able to manage, you're able to prevent yourself from having low back pain. Also, I'm going to ask for one favor, and that is to share this with someone. Share this within your networks, share this, and help someone else to be informed about how to prevent and manage low back pain. Again, this was brought to you courtesy of Fitsplurge. Fitsplurge cares.